Hello, I'm Scott Knoer, the Chief Executive Officer at the American Pharmacists Association, or APHA. I would like to acknowledge and thank my pharmacy colleagues at the Egyptian Foundation of Clinical Pharmacy and all of our pharmacists around the globe on World Pharmacy Day. Pharmacists' role in public health is always important, but has really been highlighted by COVID-19. Our pharmacists around the world answered the call as we and our interdisciplinary healthcare colleagues, such as physicians and nurses, selflessly went to work to serve our patients around the globe. Initially, we didn't even have personal protective equipment or plexiglass barriers, but we selflessly put ourselves at risk to serve our patients. That's what we do. We put patients first. We care for our communities. At the outset of the pandemic, speaking for the United States, pharmacists were one of the few places that were open when physicians' offices were closed and hospitals stopped performing elective procedures. We served. We ensured continuity of care. We ensured that patients could continue to fill their maintenance medications and fill new prescriptions. We adapted to the ever-changing circumstances. When there were questions about hydroxychloroquine, we researched the literature and educated our patients and our physician partners. We set up curbside pickup so that patients did not have to come into our pharmacies when they were concerned about contracting COVID. We created logistics to handle remdesivir. We created testing sites, and we helped create and stock overflow field hospitals with medications. What have we done at the American Pharmacists Association, at APHA, to help our pharmacists care for patients during this pandemic? We created rapid education for our members. One of those tools was a weekly 15 on 19, meaning a 15-minute webinar on COVID-19 that had the latest information that really became the go-to source of the latest information for pharmacists every week. We also created another weekly webinar featuring real pharmacists on practice, allowing our members to ask the experts. We put together practice resources to guide pharmacists, such as how to understand testing, understanding the regulatory changes and updates that occurred rapidly, and to understand new drugs under investigation to treat COVID. Advocacy is a very big part of what we do here at APHA, and we work tirelessly with the government to allow pharmacists to order and administer pediatric vaccines as we saw vaccination rates decline due to the lockdowns. Also, to allow pharmacists to order and administer COVID-19 testing and ultimately give vaccinations in all 50 states when a COVID vaccine becomes available. And we're working hard to ensure appropriate payment for our pharmacists. Related to immunizations, we have created information on how to adapt current immunization practices for COVID, how to protect yourself during immunizations, what recommendations are there for receiving other vaccines in the COVID-19 setting, and what screening measures do we use for our patients to keep our pharmacy staff safe. In summary, I wanted to say thank you to our pharmacists around the globe who selflessly serve our communities every day and who really excelled by answering the call throughout this pandemic. I wish you all a happy World Pharmacist Day, and I look forward to helping you serve our patients around the globe. The American Pharmacists Association appreciates you, and we will tirelessly advocate for you wherever you serve. Thank you.